This week could mark the beginning of the end of COVID-19 in Texas.
Yeah, let's hope so, because today some of the 1.4 million doses of the Pfizer and BioNTech COVID-19 vaccine could start to ship out and head our way. Candy Rodriguez joining us live from Del Seton Medical Center at the University of Texas to explain how soon these vaccines can go to healthcare workers and the shots in the arms this morning. Good morning, Candy.
Sally, Tom, good morning. It could happen as early as tomorrow. That's after the FDA gave the green light over the weekend. Now, healthcare leaders tell me if those vaccines are shipped out today and if they happen to arrive today, it could happen as early as within a day or two that we can start to see those vaccines roll out. Now, Del Seton Medical Center here is one of a little over 100 hospitals expected to get those vaccines for their healthcare workers who are first on the list to get the shot. This morning, the future looks a little brighter.
I think we're very excited that this is the light at the end of the tunnel.
Dr. David Lakey is one of more than a dozen healthcare professionals helping lead the way for the COVID-19 vaccine distribution in the state.
A lot of planning has been put into place so that they can very quickly start immunizing individuals.
Lakey says officials are working to secure logistics, from how hospitals will receive the vaccine to figuring out safe places to administer the shot.
All those things have to take place and be done right if we're going to go from this pizza box of vaccine that's arrived to actually having vaccine in people's arms.
Once ready to go, immunization will consist of 2 doses. The second dose of Pfizer's comes 21 days after the first, and some studies show the vaccine could begin to provide protection against COVID-19 just 10 days after the first shot.
Once we can get people immunized, we'll be able to get people back into society and see our loved ones and our family.
Now, later this week, Moderna is expected to go before the FDA. If cleared, then we could start to see some of those vaccines roll into Texas sometime next week. Now, ask Lakey, when can we expect the vaccine to be widely available to the general public? He says sometime late next summer into early fall. Guys.
All right, Candy Rodriguez on an exciting morning for us. Thank you, Candy. Of course, those next batch of immunizations would go to those living in long-term care facilities and their caretakers.
Yeah, vulnerable population. Those vaccines could start to happen before the end of the year. So later on this month. Now, Lakey, that you heard from in Candy's story there, says hospitals plan to stagger their immunizations across departments. For example, they will not administer the shot to every ER doctor on the same day to ensure that they have enough people working in case some do experience some side effects and need to stay home, which likely will expect some sore arms, but will go away.
And we checked in with other hospital systems in our area. St. David's tells us it expects to receive the first shipment of the Pfizer vaccine early this week. Hospital employees there who provide direct care to infected patients, they are going to be very first in line. Baylor Scott and White telling us it's going to begin vaccinating frontline caregivers who've opted in as soon as this week as well. It intends to accommodate every healthcare worker who's interested.
Well, the state's hospitalization is still going up. More than 9,000 people are fighting this virus inside the hospitals. So this is just the hospitals we're talking about. There is no bed space this morning in Lubbock. That's how bad the situation there in that city. If you take a look at that city's COVID-19 dashboard, which is what you're doing right here, zero beds left. Right now, there are 30 patients waiting for a bed, but only 30 beds are available.